Prior to 2017, when you called our team, Calgary 911, and what are you looking for, an ambulance? Go ahead. Right there, we start building the call. But now what happens is you say, you're looking for police, fire, and we need ambulance. Stand by, I'm going to transfer the call. Because we had to do that to keep the contract. So even within the four walls of our center, because of the contract, I have to transfer it because they won't be on our CAD. They wouldn't share the same CAD, so they have their own CAD. So I have to transfer it. Just that comms time of doing another transfer. So you have to remember, they were on the phone waiting for us for about 6 seconds on average. Then we answered the call, and then we transferred over to the AHS pod within our, that's 49 seconds of time that's gone by. Where in 17, where are you at? When right away pre-alert, we're sending AHS and fire. The difference is it takes 49 seconds before that happens now.
We've never actually heard from Alberta Health Services or Alberta Health the answer to a simple question. Why? Why do this? What about this change makes sense? The Minister of Health in the same day last week said it's not at all about money. He'll invest money if it's better patient outcomes. And at the same time said this will save money. We have heard Alberta Health go from this won't make things much worse to this won't make things worse to this will somehow improve patient outcomes. We've seen no data. We've seen no cash flow statements showing how they intend to save money over time, given that they are renting extremely expensive office space in the city instead of taking City of Calgary space for free. Given the fact that they have invested in a very expensive mapping system instead of taking the municipality's very accurate mapping for free. I don't understand where these supposed cost savings will come from. And certainly, no one has ever made the case that this will decrease response times or improve patient outcomes. So I'm left really with the question of why are we even having this conversation? Our argument is that it makes much more sense to integrate the system geographically so that a Calgarian can get the help they need, whether it's police, fire, ambulance, or mental health, instead of putting AHS all in one silo, because quite frankly, that patient in Calgary doesn't need to communicate with someone in Whitecourt. It doesn't improve their outcome in any way. This plan is over 11 years old. Technology has changed since then, and when asked, the chief paramedic just says, but I've been wanting to do this for 11 years. It's my plan from 11 years ago. Well, everything changed 11 weeks ago, let alone 11 years ago, and we certainly need more than that. And plus, he's got 10 years of evidence, so show us the evidence in the 60% of Alberta where it has been implemented that it actually has improved patient outcomes. He can't because it doesn't exist, because it didn't improve patient outcomes.